Hello to this special episode of The Doc is In. We're here at Arab Health. My name is Moatasem Ahmad, and my guest today is Dr. Samah Nour, the chairman of Caregiver Wellbeing at Cleveland Clinic Abu Dhabi. Hello, Dr. Samah, and thank you for making yourself available for us today.
Thank you.
So let's start with the definition of well-being. What does it consist of, and what do you do?
Caregiver well-being means being healthy, happy, and prosperous. Healthy means you are in good physical health, whether you're able-bodied or not. Happy means you're in good mental and emotional health, and hopefully in good spiritual health as well. And when we talk about prosperous, in general, it means being connected to your work. So in general, it's linked to your domains, your well-being domains. So there's so many of them, but prosperity in general, we link to your occupational well-being, which is why I do occupational health at Cleveland Clinic Abu Dhabi.
Great, and how do you maximize these three pillars of well-being?
So as a caregiver, which is the name we give to all our employees at Cleveland Clinic Abu Dhabi, your journey with us starts before you join the clinic. Number one, we ensure that you're in good health to come and work at Cleveland Clinic Abu Dhabi. And if you're not, we try and maximize your health as you join Cleveland. As you come in, we have this unique medical service where we see you once a year. This visit once a year is to look at your physical health, your mental, emotional health, and we also do things in terms of organizational well-being. We have a portfolio of well-being services. So these include things like employee assistance program, and that offers psychological support for caregivers in need. We have Emerge Stronger, and that's a second victim program for those involved in any sort of medical errors, where when we talk about second victim, the patient is not the only victim. Sometimes the healthcare worker or our caregivers are also the other victim. And in addition, we recently rolled out additional programs such as mental health first aid, and that allows a peer-to-peer support for those people in distress, or for example, somebody's going through a panic attack. We have those peer-to-peer supporters. For physical health, we have world-class gym that offers almost hourly classes in mixed gender and single gender. And we also have things that look at organizational well-being. So things like our work-life policy. For example, one of the things we looked at recently was a remote work policy. So in alignment with the Emirate of Abu Dhabi, we have 4 days in which people in the non-clinical realm are able to work remotely. And I think one of the lessons from COVID was that when you give people more flexibility, they tend to call out less on sick leave. And now with the technology, they're able to do their work wherever we have. So we've been able to help a caregiver wherever they are in their well-being journey. In addition, we also have Wellbeing Academy. And Wellbeing Academy is a CME accredited course that we offer about once a month, in which we teach people about things from nutrition to physical energy, to cardiometabolic risk factors, to things that are on people's minds, whether it's social media use, whether it's global warming, and we usually use internal speakers or bright stars within UAE. And we've been lucky to have many touch points where people participate in our caregiver well-being programs voluntarily. So we have more than 1,500 touch points just in the last year alone.
Now, doctor, with all these activities, well-being is costly. Why would an organization invest in this?
So at high level, for every dollar you invest in well-being, you're saving $3 to $5 down the line. The American Medical Association has estimated that for every physician that leaves your practice, that is a cost of about $500,000 to $1 million. So think about that. For organizations to be sustainable, you have to retain your physicians. So for if you have an attrition rate of 10%, you can only estimate the cost of when these people leave your institution.
Thank you, Dr. Samah. Now, one of the most prominent issues in workplace, especially in healthcare sector, is burnout. How do you manage this issue?
So burnout is a complex issue. As we know, a healthcare worker is twice as likely to struggle with burnout than any other profession. So let that sink in. So when we look at physicians, even though when you look at all their other dimensions of health, they tend to be healthier, the mental stress due to the complex systems in which we operate tend to be twice as likely. So what does that lead to? That leads to personal risks for the physician, but also professional risks. So in Cleveland Clinic, we're proud to be chasing zero harm, but burnout does increase your risk of medical errors, of having subpar medical care, but also at a huge financial cost to the organization. For every physician that leaves the organization, the cost is about $500,000. On the flip side, burnout affects the individual in many ways, whether it's higher incidence of alcohol and substance abuse, or leaving the profession altogether, or suicidality. I know we're lucky in UAE, we don't have high rates of alcohol and substance abuse and suicidality, but in general, burnout causes people to leave the profession in higher numbers than ever before.
So, doctor, given the size of our organization, we have over 5,100 caregivers. How do you maintain connectivity among all of them?
So I'm very humbled to be able to take care of the health of our caregivers. So through our annual visit, we get to see all the caregivers. And what I can say about the environment in which we work is that it's very informal. So even our C-suite has an open door policy. So I can tell you that from the time you walk in till the time you leave, you interact with so many caregivers that feel as a part of your community. It's not just about the work that we do, it's about us aligning to a mission and understanding that what we do within our domains affects patients' lives. I think this is really the magic of Cleveland Clinic, is our connectivity to each other.
Yeah, I sense that. I think the sense of belonging is really amazing here. Okay, so doctor, if there is one thing you can say about enhancing my well-being, like because you always get this question, right? What would it be?
So I think number one, eat well, meaning eat nutritious food that balances your energy. Number two, move more. No matter where you are in terms of movement, you can always do a little bit more. And number three, maintain your mental health through connectivity, through your social connections, through doing work that's meaningful to you. I think if you do all these three things, you're in pretty good shape.
Thank you, Dr. Samah, for all the insights you've shared with us today.
Thank you.
And thank you, our audience, for listening. See you next time.